Hi, I'm David Seymour and the candidate for Whangarei, and today I'm just having a chat with Gary Payinda, who's a doctor down at the Whangarei Base Hospital, and we're going to talk about the end-of-life choice referendum that's coming up in the 2020 election. Hey Gary, thanks for spending a bit of time with me.
Happy to be with you.
Gary, let's just start at the start. End-of-life choice. What are your thoughts about patients wanting to slide on out of here on their terms rather than just waiting to die because that's the way it is currently?
My thoughts are that if a patient is terminally ill, meaning they're dying anyway, and they don't have long to live, like under this law at 6 months or less, that forcing them to prolong their dying process, not prolong their life and their happiness and their enjoyment of life, but actually prolonging the bad part, the suffering, the uncontrollable pain, or whatever their symptoms might be.
Yeah.
The idea that we would force someone else to go through that when they're dying already, it just is like adding insult to injury.
Yeah.
I see end-of-life choice as being about compassion for people to make a decision themselves that things have gotten so bad in their dying process. You know, like most people that use this law will have cancer, the vast majority. Some will have motor neuron disease. But whatever the case, when the person has gotten to the end, that's their decision. That's for them to decide when life has become unbearable and the suffering is too much. And the point, again, here is that this is not for someone with depression, other mental illnesses, disability, old age, feeling like they've lived long enough. This is purely and specifically for people with terminal illness who are going to die soon, who are in a dying process.
Yeah.
And the idea that as a doctor you would withhold a medicine that could relieve suffering just never made sense to me.
Does the use of a medicine like morphine, does it totally alleviate people's the stress and the pain that they're going through? Because when we talk about suffering, we're not necessarily talking purely about pain, are we? We're talking about mental suffering as well.
Yeah.
So morphine, how does that come into the equation in that sort of circumstance?
So morphine and all its derivatives, fentanyl and other things, are really good for treating many kinds of pain, most kinds of pain. But there are some pains, some types of pain that it can't cover, and there are some people who won't get relief from it. There are other medicines that we can try, neuropathic pain agents and other things, but every medicine comes with side effects, and for some the side effects are going to be such that they don't want to be doped up.
Yeah.
They don't want the constipation that comes with opioid analgesia, or they don't want the other side effects of feeling cloudy-headed. And certainly if we talk about non-pain problems, there are people whose, let's say cancer for instance, it can cause fluid to accumulate in your lungs and in your tummy. It makes it hard to breathe, feeling like you're suffocating. As a doctor, I can remove that fluid with a needle, but you can only go through so many taps, which are painful, uncomfortable. You can only go through that so many times before some people say, like, this is just suffering. It's not quality of life anymore.
Yeah.
It's not just about the pain, but it's my life is more than just being medicalized and being a dying process,
Yeah.
and I want it to not continue.
Yeah. Okay. You know, like I've used the phrase "it's my life, my choice." So when it comes to that point in my life, maybe, and I haven't decided whether I'd use assisted dying yet or not, but I'd like the choice. There's people who have serious concerns about coercion, and coercion can go both ways, can't it? So one person is saying, you know, like some people say, oh, we might coerce Granny into taking the assisted dying earlier than what she probably should or could. And then you've got the other end of the scale where coercion could come into the fact where people say, oh, we don't want you to do it yet because we want you to stay with us, or hey, what they're really saying is they're not ready to face the inevitable. What are your thoughts on those?
I do think you're right. Coercion takes many forms, and I think one of the types of coercion that we see most frequently is people being forced to do things that they don't want to do. At some point, I think people should have the right to say enough's enough. Now again, these are people who are already dying, and that's the key here.
That's it,
it's not that I feel old and I want this to be over. I have a disability and I want it to be over. I'm in pain and I want it to be over. These are patients whose disease process is going to kill them in the not too distant future. And I think we need to have respect for their decision-making capacity. The alternative, of course, is that we make decisions for them on their behalf. And if you are of sound mind and you are experiencing what you're experiencing, who am I to go to you and say, no, that's not an option for you? Yeah. I have decided it's better. Maybe because I have religious dogmatic beliefs, maybe it's for whatever reason, but like in what other realm can I decide for you what's best about your dying process? It just, again, it makes no sense to me that you would take that away from a person.
True.
And the point is, we'll never be forcing or even pushing anyone to do this who doesn't want it. The very first part of this bill is that the patient must come to the doctor and ask for medical assistance in dying.
Yes.
If a doctor even suggests this, there can be a complaint lodged against them, and they go through the health and disabilities review, and they can be prosecuted essentially for that. It can't even be something that the doctor says, this might be an idea, this is an option.
Yeah.
You can't even mention it as a doctor.
No.
The patient has to literally be the one to say, doctor, I'm interested in this, can you tell me more?
Yeah. So, religion and culture governing probably a lot of people's decisions on how they're going to vote. Not an easy one. I certainly don't want to offend anybody about it because we're all entitled to our religion and our culture. But do you think there comes a point when we've got to put that aside a little bit and think about the humanity of the person who is actually terminally ill?
Yeah, I think it all gets back to the idea that the person who understands this problem best is the one who's living it within themselves, in their body. They're experiencing it. And all of us can have our own ideas and our social mores, and there's a lot of religious fundamentalism that goes into this, where people say it's against my Catholic faith or this or that. But at the end of the day, we have to decide whether we want to be making decisions for others who are fully capable of making decisions for themselves. Because another aspect of the law is that the patient not just has to initiate it, the doctor or nurse practitioner has to at multiple times in the course of this thing reiterate and reestablish that the patient still wants it, that they've considered alternatives, that they understand the risks and benefits and the implications of it. The doctor's got to go to the patient's other healthcare providers and correlate information from them. So, yeah, to answer your question, that's a roundabout way of getting to it, but all of us have to decide whether we're going to respect patients enough to actually listen to what they're asking for, rather than projecting our hopes, dreams, and desires onto them.
Yeah. So really, I've been saying to people for the last, I don't know how long, this referendum is about choice. It's about the individual's choice. So by voting yes is giving people the choice. By voting, and then if you don't want to use assisted dying, you can say, hey, that's not me. I'm happy to lie here and suffer.
Absolutely.
I'll take all the medicine you can give me and I'll pass more naturally if that's what people want. But by voting yes gives the other people the opportunity, doesn't it, to say, hey, actually, I've had enough and I want to slide out of here. Whereas, if you vote no, you're actually going to take that democracy, what's the word? Democracy out of it really, and people won't have a choice. If we don't pass this referendum this time round, it might be 10 years before it'll come around again. And there's going to be a lot of people in that 10-year period that are going to suffer, die sadly and suffering in agony. Because
Unnecessarily, really, is the way I see it.
Yeah,
Just,
unnecessarily.
that's the shame
Yeah.
in it all. It doesn't have to be this way. Worldwide, something like between 100 and 120 million people in democracies worldwide have legal access to medical assistance in dying. And it's probably about time we did too,
Yeah.
right? If this is working in so many other places, if it works in Melbourne, Australia, if it's going to get, it's passed law and it's going to be starting in Western Australia, if it's working in the Netherlands or Belgium or Luxembourg or Oregon or California or just dozens of places, if it works there, maybe all of the kind of panicky talk we hear about it, these doomsday scenarios of it will lead to a slippery slope that leads to the death of elderly and disabled folks and create just havoc. Well, we have to look and say if 120 million people have live in a place where it's legally accessible, they've passed laws, right, to get it legally accessible. They've had it for sometimes 15 years in some cases, and they have never repealed that law.
No.
And they support that law. So I learned something, I think it was the Netherlands, where the membership in the medical assisted dying, so the end of life choice party or organization, the actual membership in that organization in numbers is larger than the membership of the largest political party in the Netherlands.
Wow.
Now, if it was even 1/100th as bad as some people make it out to be, then why would so many people around the world love the fact that they have access to it? Which isn't to say you or I are going to use it,
No,
but
absolutely.
to have it as an option when we're terminally ill and dying and suffering just seems humane and seems appropriate.
Sensible.
Yeah.
So for the people watching this video who may not know, but I am actually terminally ill with motor neuron disease, and I've supported the bill and the act and the referendum from when it first came to fruition in Parliament, and as yet I have still not had a firm decision whether or not I would use assisted dying when I get to that point in my life. But all I'm suggesting to people that give us, and I say us, terminally ill people, the opportunity to have that choice. So one of the things actually we talked about really just before we started recording was about regardless of whether I'm terminally ill or whether I'm just sick, I can have a do not resuscitate order in place, and the doctors have to respect that. And I can say to the doctors, I don't want to use this medicine anymore, it makes me feel sick, I hate it, it hurts.
Or I don't want the surgery.
I just don't want the surgery.
Yep. Even if it's a life-saving
Even
surgery,
if
you can
it's
say, I do
life-saving.
not want it.
Yep, I don't need it, I don't want it, I need it, but I don't want it. And same with equipment, as an individual, I have the right to say, please turn off any medical equipment. I don't want to use that process. And so all those are perfectly legal. So, and whether I'm terminally ill or not, and each of those could lead to me passing away by taking one of those choices, or all of those choices. So why not have the opportunity to ask for assistance when you've had enough? That would be really it, isn't it? Why not be able to be humane and ask for some compassion?
So I'm an emergency doctor. I work in an emergency department. I treat people with strokes and heart attacks and car crashes and things. I've had a lot of patients die under my care or in front of me in the emergency department. And the thought that this is different, that we have to take away people's decision-making capacity because they're terminally ill or what have you, the idea that it would be different doesn't sit well with me because, dozens of times a year I'm making life or death decisions in conjunction with patients. We have a conversation of what are their goals and hopes and expectations, what are the risks and the benefits of this procedure, and if we, like you said, if we can trust adults enough who are of sound mind to make a decision for themselves in all these other ways, people are deciding to refuse chemotherapy or refuse renal hemodialysis, right? And they can understand that without it they will die, but it's still their decision. They're the ones having to live with the implications of it. So of course they need good information, right? They need a chance to discuss it and ask questions and be informed. But at the end of the day, it's their decision. And to think that in this most important of times, when they're dying of a terminal illness, that we would take away that right to say, no, I'm sorry, because you're dying, we will make that decision for you, and it's not going to be allowed. And no, you can't go to your doctor and ask for something to end your life when you're already dying of a terminal illness and suffering. It just doesn't make any sense to me.
Yeah, so look, I think we'll wrap it up with that. I think that's cool. It puts the whole procedures into perspective. So guys, girls out there, if you've got any concerns, please do your homework about it. It's taken 2.5 years to get to this point, and if we don't have the yes vote, as I said, it could take maybe 10 years before that comes around again, and in the meantime a lot of people would die suffering unnecessarily. So let's have some compassion, New Zealand, and thanks Gary for your time and your input to those questions.